Chapter 5, Carbohydrates Screencast 5. Now we're going to take a deeper dive into diabetes mellitus. Now, when we see the term mellitus, we have to keep in mind here, that's how we refer to diabetes. There are other types of diabetes, diabetes insipidus, so you have to make sure that mellitus is the one that we are actually talking about. Now, fasting blood glucose levels at or above 126 milligrams per deciliter, hemoglobin A1C level at or above 6.5%. Those are typically the criteria that are used to diagnose diabetes. There are two main types of diabetes, type 1 or insulin-dependent diabetes, or type 2 insulin non-dependent. So when we look at the type 1 diabetic, those are individuals that are not capable of producing insulin. In type 2 diabetics, the issue is actually what we refer to as insulin resistance. Now, there is one other type of diabetes, and this is a diabetes that occurs during pregnancy and known as gestational diabetes. Generally, after the pregnancy, the diabetes is resolved, but there is evidence that this is a higher risk factor for actually developing type 2 diabetes. Now, when we look at type 1, these are the symptoms that we typically expect to see: hunger, thirst, urination, weight loss, exhaustion, and blurred vision. Now, the onset typically occurs between ages 8 and 12, so the tween years. There is some degree of running in family, so a little bit of a genetic disposition here, but it's thought to be caused by an autoimmune disorder that actually destroys the insulin-producing cells. And because of this, there's going to be a decrease or total lack of release of insulin. You're going to see higher levels of blood glucose, and then you're also going to find glucose in the urine because you're basically overwhelming the kidney's ability to actually reabsorb glucose, which is typically reabsorbed at a rate of 100%. Now, there's two major treatments. You must have insulin therapy because, once again, the pancreas is no longer producing insulin, so it has to come from somewhere. Nutrition therapy, because it really is important that the diabetic, especially the newly diagnosed diabetic, learns how to eat properly. So 3 regular meals and snacks, individualized plan for carbohydrate, protein, and fat intake, a need to lower the intake of saturated fats and cholesterol. Now, some strategies that are used are carbohydrate counting and the diabetic exchange system. And this is a scale of basically ranking carbohydrates anywhere from 1 to 12 points based on 15 grams of carbohydrate. Now, if we look at the short term, typically it's going to be a state of ketosis. Ketosis develops when fat is being used for energy because, remember, the glucose is in the blood, not in the cells that are really providing and maintaining homeostasis. So the fat is converted to ketone bodies. And what happens, the ketones actually pull sodium and potassium ions with them into the urine. This can result in a pretty significant ion imbalance, dehydration, coma, and in the worst cases, actual death. Here we can see some of the long-term health issues that are associated with type 1 diabetes. It's the number one cause of non-trauma related blindness, very significant risk factor for cardiovascular disease, kidney disease, neuropathy, so many types of issues, and increased risk or prone to developing infections. And diabetes is also the number one reason for non-trauma related amputations. And then we have kidney disease. One of the dogs that I owned in my past was a diabetic. And when I was talking to the vet about the future, she basically indicated, the outcome, we can manage the diabetes, but eventually there would be a point where she would get to kidney failure. And that was actually the complication she was experienced that resulted in having to euthanize her, chronic kidney failure. And once again, she had been diabetic. Now, type 2 diabetes, this is the most common type of diabetes. This is very much linked towards lifestyle. So inactivity and obesity are major causes of type 2 diabetes. The situation here is an insulin resistance, or cells no longer responsive to insulin. So the insulin is there, it's just not effectively regulating blood glucose. So the glucose is not transferred into cells and it accumulates in the bloodstream. Treatment includes significant lifestyle modification and use of medications. At first, generally, they're going to be looking at the impact that lifestyle modifications are going to make. These are always the first to make, and on their own can be very successful. Now, nutritious diet, if we look at physical activity and weight loss, have all been known to lower blood glucose levels in the type 2 diabetic. Now, there's also a number of medications that are oral in nature, and some may actually require insulin injections. Now, here is a comparison between the two. I'm not going to really go through this all. You can actually read this on your own, but you should be comfortable with the differences between type 1 and type 2. That could be something that I ask on the upcoming exam. Now, the gold standard test is a glucose tolerance test. And look at the non-diabetic here. Okay, so they're given a standard load of glucose and then basically looking at blood glucose across time, typically 3 hours. So what we see here is the non-diabetic curve. It hits the peak and then it actually lowers back to normal resting levels. Look at the diabetic. So here, not only are they starting higher, significant, huge increase in glucose in blood glucose in response to the load, but look how long it stays elevated for. So that's generally the test that they use to diagnose beyond blood glucose levels, diabetes. The last couple of slides are going to focus on what's known as glycemic index and glycemic load. And this is an indicator about how blood glucose responds to certain foods. The glycemic index is a ratio of blood glucose response of a food compared with a standard. Now, there are some weaknesses in using glycemic index, and a lot of them are dependent upon the characteristics of foods. It could be the structure of the starch that's involved, how that food was processed, how much fiber is in that food, structure, temperature, what other nutrients were in the meal, and which things were consumed. So things to keep in mind. Now, the shortcoming is also based on serving a food that would provide 50 grams of carbohydrate, and that may not be realistic serving size. Now, glycemic load, this actually takes into account the glycemic index and the amount typically eaten. So this better reflects a food's effect on blood glucose. And when calculating, it's going to be grams of carbohydrate in serving times the glycemic index for that food divided by 100. Now, foods with a high glycemic load, those are individuals that are going to have an increased insulin response to that food load and then a drop in blood glucose. Now, the issue here is these chronically high levels of insulin. And that can lead to an increase in fat synthesis in the liver and also a more rapid return of hunger after the meal. Now, when we're looking at glycemic index and glycemic load, reference food glucose, 100, and all other foods are compared to that. Low glycemic index foods are those below 55. Intermediate glycemic index foods between 55 and 69. If we look at high glycemic index foods, more than 70, low glycemic load foods below 10, intermediate glycemic load foods between 11 and 19, and high glycemic load foods more than 20. Here we can basically see an overall chart that's taking into account the actual glycemic index versus load. Here you can see that they're actually looking at the amount of carbohydrate that's found in some of these standards. And if we look at brown rice and white rice, they tend to both be high to moderate on the glycemic index. Now, keep in mind, glycemic load is actually looking in grams per carbohydrate. Here, you should be able to identify some foods that are low in glycemic index and other foods that are high. I will not be asking you to calculate glycemic load. So you will be looking at primarily glycemic index and being able to identify some that are high, some that are medium, and some that are low.